I'm Leah Abacasas. I'm the clinical nurse specialist on the medicine intensive care unit here at Boston Children's, and I'm here to talk to you today about nasopharyngeal suctioning in the inpatient unit. Some reasons for doing NP suctioning include increased secretions, thicker secretions, or that the patient is unable to manage secretions on their own. Did you know that there's a difference between deep suctioning and NP suctioning? Today we're going to talk about NP suctioning, but just for your knowledge, deep suctioning is when you go past the pharynx into the trachea. The first thing to do when looking at nasopharyngeal suctioning is to go to eLibrary and type in nasopharyngeal to bring up the policy. This policy pertains to all inpatient settings with all nurses able to do the procedure. This is the equipment you'll need in order to do this procedure. A sterile suction catheter in the appropriate size for your patient. A mask and goggles or a mask with a face shield, even if you have glasses. Normal saline, and date the normal saline for 24 hours after you open it. Water-soluble lubricant. Make sure that you don't grab bacitracin or Vaseline in case, because these can actually harm your patient. A Yankauer suctioning is an optional thing to have, especially after doing nasopharyngeal suctioning for the oral secretions, and there are a variety of types. And finally, necessary to have at the bedside is a stethoscope. Optional things to have at the bedside for thinking about is an AMBU with oxygen, an O2 sat monitor, and a cardiac monitor. So Shelley's never done this procedure before, so we're going to go through it so that she knows how to do the procedure. The first thing to do is prepare the patient. So that means explaining the procedure to the patient and or their family so that they understand and they are as cooperative as they can be. Speaking calmly and reassuringly to the patient throughout the procedure is important, and for younger children, using visual distractions. So that may involve inviting your child life specialist in while you're doing the suctioning. A visual distraction that's above the child's head can help the patient, and they may look up further so that you have an easier time doing the suctioning. So the first thing you're going to want to determine whether your child needs cardiac and oxygen. The next thing is to select the appropriate size suction catheter and get all your supplies ready. So the catheter should be 1/3 the size of the nasal passage, so large enough to remove the secretions, but not so large as to obstruct their airway. The next thing is to check your oxygen and your suction and make sure that the equipment's working.
Okay.
And then you want to wash your hands and wear protective equipment as described in the infection control manual, which, remember, involves using a mask with a face shield, even for us. The next thing to do is to listen to the patient and hear their breath sounds. Next, you're going to open the container of normal saline, your packet of water-soluble lubricant, and your catheter envelope with the appropriate size catheter. You'll put on a new pair of gloves, Purell, and then put on a new pair of gloves. And then you're going to determine the length of the catheter to be inserted. So now we're going to measure the distance between the tip of the nose and the top of the ear with our catheter. For suctioning the patient, it's sometimes a good idea to have a second person available to hold the patient still and to have the AMBU bag ready if needed. You're going to keep the AMBU with the oxygen near the patient for the procedure. With the catheter vent open, you're going to put the suction catheter into the nair and advance it while the patient's inhaling. As you're coming out, you're going to constantly hold suction over the vent while gently withdrawing the catheter. Encourage the patient to cough during the suctioning and limit the suctioning to 3 to 6 seconds each time the catheter is inserted. This is to make sure that you're not taking the patient's breath away while you're suctioning the patient. The things to watch for are a decrease in oxygen saturation or heart rate, so using an oxygen sat or a cardiac monitor is useful if that's a concern. Oxygenate the patient if their color changes or or if there's a large amount of secretions and you have to do the process multiple times. When you're finished suctioning, you're going to discard the catheter and you can use your Yankauer for excessive oral secretions in the mouth. And that's how you nasopharyngeal suction. Don't forget to document in PowerChart how the patient tolerated the procedure.